Well, joining me to discuss this is the Director of Health Services, Bell University, Temitope Akpelishi. It's good to have you join us on TVC News at 1.
Thank you for having me.
What is the second World Patient Safety Day with a focus on health workers, now not on the patients, of course. Ensuring safe care is a challenge in countries around the world, not just in Nigeria. But let me ask you, how well have we fared in protecting our caregivers?
Well, I think it is a work in progress. We have not gotten to the peak yet. We are still trying. And I would like to say that the coming up of this pandemic, the COVID-19 pandemic, actually revealed a lot of issues with our health system. And we are meant to provide for the healthcare workers, for their own safety and for the safety of the patients that they are taking care of. And when we have a situation whereby health workers are not protected, they are dying, and they are exposed to all sorts of hazard, while actually doing the right thing, what they have signed for, then it becomes imperative for everybody, including the patients too, to actually, be their voice. And that is the theme of this year's World Patient Safety Day. We have to take care of our healthcare workers. We have to protect them. We have to have it at the back of our mind that when they are well taken care of, it will cascade into the society. That is the main issue. The issue is we have to get to a point where both patients and the health workers are safe in our society. Thank you.
Doctor, we've seen policies, being put out by the government to ensure that health workers are safe and, of course, to avoid the brain drain that we experience here in Nigeria. But what more do you think can be done to guarantee patient safety?
Thank you very much for that question. We have to build a strong health system. Building a strong health system means that the minimum standard, specified by WHO, the minimum standard that is being carried out in other countries, we have to get to that point. When we get to that point, then we can say, okay, we have done enough, or we are getting near to the point. You can see the state of all our hospitals, especially the public hospitals. They are nothing to write home about. You see nurses, they are protesting today, Johesu, they are protesting tomorrow. Resident doctors are complaining every day. It shows that we have not yet gotten to that point where we can have faith in our health system. They are the people that are working in that system. They know what it entails. They know what they are supposed to have. And then when all those things are lacking, we can't say that we are doing enough. That is the truth. So we need to do more. We need to build a strong health system. Now, I want to say something. It is not about the policies. I want to tell you that we have lots of policies, but it is the implementation of those policies that are the problem. We enact policies year in, year out, but are we implementing them? Are we following them to the letter? We have situation whereby government come and then they have agreement with all these unions. But the following year, you will still see these unions coming out, to protest that, okay, they have not yet, how would I put it now, the government have not satisfied their own part of the agreement. So I know it's something that we have to do. It is something that is strong, and it has to take a sense of determination and willingness on the parts of the government that we need to do this thing. We need to put this thing in place. Talking about universal health coverage, universal health coverage, universal health care.
Doctor, let me come in here. But you see that a number of times cases of patients would die untimely or suffer permanent disability is as a result of the neglect or oversight by health workers. Some persons will question the psychological well-being of health workers, wouldn't you?
Okay, very true, I will. But everything has to do with, your environment, where you work, what you work with. Like when I was listening before I came up, there was this issue of this psychosocial problems among health workers, this work overload. They run different shifts. They don't have whatever to work with, the instruments or whatever they need to work with. Those are things that can actually, cause all this kind of problems when it comes to safety of patients. We have to have that at the back of our mind. Then training and retraining. You know, healthcare, or how would I put it now, healthcare workers are not just meant to be trained once and that is all. No, training is supposed to be a continuous thing. On the job training, you know, you keep training them, they keep going for workshops, you give them opportunity to develop their skills, they can travel out of the country, people can come from outside, you know, to train and retrain them. Every day medical science improves, medical science change. You know, the process that they use maybe in the last 30 years might not be what they are using in some other countries today. Now I want to ask the question, are we in that position? Do we give our healthcare workers the opportunity to be trained and retrained? Do we allow them to go for refresher courses? I'm not trying to say that you won't have errors in some cases. No, errors will occur, but it has to be at the minimum level. At the minimum level, and patients should not die in your hands because of things that you can prevent. When something is preventable, you are not. Yes, patient safety matters. When you can prevent things, you are not supposed to fall into that error. So there are a lot of things that are actually, working against the healthcare worker in the country. And
well,
like
that's a very good place to end this conversation for now. Director of Health Services, Bell University, Temitope Akpelishi, thank you so much for your thoughts on TVC News.
And thank you for having me.